Hi, I'm James Daniels, and as part of Team 3, I'm here to discuss regulatory issues affecting home healthcare services. Home healthcare is regulated by various federal and state authorities and is characterized by several compliance requirements. The first issue affecting home healthcare is the enforcement of the False Claims Act, in which submissions of false claims are penalized, regardless of whether or not they're intentional. This is brought on by a lack of clear documentation and overemphasis on unintentional errors. This has led to higher administrative costs and has affected billing practices. The second issue is the implementation of the patient-driven group model, which has shifted from payment related to therapy volume to that of patient characteristics. This has led to reduced payment rates and increased administrative costs, which in turn has led to increased agency closures and reduced access. For patients, the reduced access has led to reduced visit frequency, delayed recovery, and higher hospitalization rates, as well as delays and uncertainty in obtaining care. Patients have limited recourse as they can't sue unless they can prove discrimination, and there's no legal right to be accepted by an agency. For administrators, they must balance compliance, financial viability, and care delivery. They are vulnerable to the threat of false claim submission or unclear documentation, as well as decreased revenue and increased administrative burden. This has led to admission practices that have worsened access. These regulations walk a fine line between preventing fraud and limiting patient access, but it fails both stakeholders in the industry. Administrators are overwhelmed by contradictory regulations, and patients experience reduced availability and quality of care, especially in those in more vulnerable populations. Recommendations for these issues are safe harbors for good faith documentation errors, clearly defined patient characterizations, financial support of the workforce, and reimbursement reforms. This will protect the integrity of the home health care industry and preserve patient access. Thank you.